Hello, guess who? It's Beth Wright, and I am doing Chapter 38. This is for NUR 136, Unit 5, the last unit. I know you're excited about that. Okay, so we're going to be talking about diarrhea. Wonderful subject, right? So let's talk about some definitions here. And so I know you probably didn't think that uh, diarrhea would have such a definition, but it truly does. So it is the increase of liquidity, I'm not sure how you say it, liquidity of stool or the frequency of defecation. Now, defecation means bowel movement, okay? So, frequency of defecation 3 or more times per day. And of course, the consistency of the stool. Diarrhea is usually considered where the stool is not solid, it's liquid or a lot of liquid. Now, inflammatory bowel disorders, you're going to see that. You already have seen that a few times in your studies of medicines. But inflammatory bowel disorders are where the mucous membrane of the bowel is inflamed and it secretes large amounts of fluid into the intestinal tract along with mucus and protein and blood. So you also have an important word in here, inflamed, meaning that we got an inflammatory process going on within the bowel. Okay? So, we can have lots of disorders here. It can be Crohn's disease, it can be ulcerative colitis, and I'm going to show you some pictures of what the inside of the bowel will look like for someone with these disorders. So, just like with anything inflamed, the bowel can be that way as well. Okay, irritable bowel syndrome. You're going to see that. We don't have inflammation with irritable bowel syndrome. It's more of a functional disorder of the intestinal motility. So with irritable bowel, you can either have someone that has diarrhea or constipation or both. So irritable bowel syndrome, not inflammation, it is a syndrome, and it's a functional disorder. Steatorrhea is loose fatty stool. So you're going to see, uh, I don't have a picture of this, but you're going to, see this with individuals at times, especially like if there's a liver issue or some kind of problem with our digestion of fats, and the stools will be fatty looking and they will also float. So it's a fatty floating stool is what that looks like. And then traveler's diarrhea, they refer to that in the book about when someone maybe is traveling to different countries and the water or food is contaminated by E. coli, bacteria, E. coli. And so they refer to that as traveler's diarrhea. So one important question to ask individuals with diarrhea is, have they been traveling, especially, to countries where they don't treat the water? Um, okay, so the objective, I thought I would add that to this particular slide just to where it's going to make sense here for you, is to identify common causes of diarrhea. So we're going to talk a little bit first about the symptoms and then we'll get into the causes here. But diarrhea is a symptom of numerous conditions for sure. That causes increased motility. So the motility word means movement. It causes secretion or retention of fluids in that intestinal tract, in that lumen of the intestines, and can cause inflammation or irritation of the GI tract, which results in a rapid propulsion of bowel contents toward the rectum. And we will have limited absorption of fluids and electrolytes within the body like we need to when we're having diarrhea. Now, decreased fluid absorption can be due to several different things here. It can be due to malabsorption syndrome. It can be because of mucosa damage. For instance, patients who get radiation because of colon cancer, they can have damage to that colon and to the mucosa, so therefore it causes a limited absorption of fluids and electrolytes, because we got to absorb that back into the body so that we function. So the fluids and electrolytes. So um, the pancreatic insufficiency can cause uh, decreased fluid absorption. Intestinal enzyme deficiencies, bile salt deficiencies, a decreased surface area due to if part of the colon has to be taken out because of colon cancer or something like that. That's going to cause a decrease in that fluid absorption. And, so anytime we have a decrease of our fluids being absorbed and our electrolytes being absorbed, then we are concerned about dehydration. So we got to be thinking about dehydration anytime that we're talking about folks with diarrhea. Now, the increased secretion of fluids being secreted because of diarrhea, that can be due to different things as well. It can be due to some kind of bacteria like food poisoning. So, infection. It can be caused by drugs. So, maybe a patient's overdone the laxatives. A lot of elderly people, they are indeed um, kind of fixated on their bowel function. So they may actually, overdo the laxative thing. Um, there's another medication, sorbitol, that is in a lot of elixirs. If you look at the ingredients of different elixirs, you'll see that sorbitol, and that can cause, someone to have diarrhea. Um, Hormonal issues can cause diarrhea, and of course, tumors can cause diarrhea as well. Now, motility impairment, such as when we think about that part of it being a cause of the diarrhea, it can be related to the irritable bowel syndrome. Um, increased visceral sensitivity, which is where, when you see that word visceral, you think like the organs or near the organs. It's a deep type of thing, so it's that area is sensitive. Also, diabetic enteropathy can cause diarrhea, and that's related to the peripheral neuropathy of diabetes. Um, Someone who has had gastrectomy surgery, they can have conditions such as dumping syndrome, and that is where there's a rapid gastric emptying that occurs anytime that they eat, and that causes a drop in the blood sugar, and they become faint, and of course they have diarrhea. So dumping syndrome is like, when it dumps out really, really quick. Um, so symptoms can be acute diarrhea, and again from infection, bacteria or viral, can be explosive and watery. Um, and tenesmus, you'll see that word in your reading as well. That's where there's a spasmodic contraction of that anal sphincter with pain and a persistent desire to defecate. Also, abdominal cramping, perianal skin irritation as well. Now, you've got to think about that when with anybody having diarrhea. They can, if they have a lot of diarrhea, they can definitely have skin irritation. It will break down the skin, such as a little bambino, a baby's bottom getting a diaper rash. That can happen to adults as well. Um, there can be systemic signs as well, such as nausea, vomiting, a malaise feeling, which is, just feeling like crap or feeling bad. Uh, we can also see the leukocytes elevated, so leukocytosis, and blood and mucus in the stool. Especially with the infection type, we got to get that stool out. We don't want to take something to stop the diarrhea because there's bacteria in there. So we got to get we got to get the infected stool out of there. And of course, they'll have to be on, if it's bacterial, they'll have to be on antibiotics for that. Now, chronic diarrhea is when the diarrhea persists longer than 2 weeks, and so that's what we will refer to as that. And so the complications with diarrhea are, of course, dehydration, which we talked about, an electrolyte imbalance for sure. And so when we're thinking about dehydration, we got to think about what are we going to see with our patient with dehydration. Their lips are going to be dry. You'll ask the patient, let me look in your mouth, stick your tongue out. Their tongue is going to be dry. Their oral mucosa is going to be dry. Their skin's going to be dry. You'll learn to do a test called skin turgor, where you pinch the skin up and the skin will stay tinted for longer than what it should for someone with skin with dehydration. So the skin turgor will be tinted. Um, other signs like the eyeballs are sunken, especially with children. Eyeballs sunken back, a pale color. I mean, you can a lot of times see that with individuals. And when you look at the face, the temporal area, sometimes you'll see that with individuals that it's sunken. So you'll see different signs and symptoms there of that. And of course, to assess, we're going to assess the body. We're going to do vital signs because, vital signs when dehydration is severe, the patient can go into what we call hypovolemic shock. And anytime with this type of shock, you're going to see an elevated pulse. You're going to see a low blood pressure, so hypotension. Sometimes respirations are going to be elevated. You might see a temperature, especially if it's a bacterial thing. They may have a temperature. Anytime a person has a temperature, they're again at risk for even greater dehydration because we're losing fluid through that temperature. So we're going to also talk to the patient about, a history of travel, what is their medication use, what's their diet, how much are they drinking in a 24-hour period, what kind of previous surgery or radiation they had, are they anemic, do they have elevated white blood count? You'll look at your lab work. You're going to look at your electrolytes because we want to look at that potassium, sodium, chloride, phosphorus, the magnesium, all of those electrolytes for sure. And we, of course, want to look at the stool. So we're going to look at stool for the amount, the color, the odor, and they can check the stool in the lab. There's a test called occult stool, occult, and what that is, occult, OCCULT, that's checking for blood, hidden blood, blood that's not visible to the eye. They can check for mucus, white blood cells, parasites, any kind of bacteria, and they can do that sensitivity to the stool culture test to see if in fact there is, a bacteria, what's the best antibiotic to use to treat it. Also, they can test for fat in the stool as well. Another test that we may see done is an endoscopy test, a colonoscopy, if you will. It's a scope. And basically, that scope is like a long tube with a light and a microscope at the end of it so that you can see the inside of the bowel. And, the doctor can, do a biopsy there, get specimens and that kind of thing to check for, different types of problems such as cancer. That's where they, remove polyps and that kind of thing. Also, another common thing with diarrhea is C. diff, C. difficile. That is a bacteria that has grown. So, it's an organism, okay? And many times we see this because people have taken certain types of antibiotics that, the C. diff is a normal bacteria in our colon, but when someone takes antibiotics, it gets rid of the good bacteria, if you will, because we do have good bacteria in our body, and then we end up having an overgrowth of the bacteria, and it causes real problems there. So it can cause mucosa damage, and it can also lead to a condition called pseudomembranous um, enterocolitis. So that and it can also cause a perforation of the bowel if it's really bad. So we can see a real problem there, and you'll see that referred to as supra-infection when that kind of thing happens. So C. diff is definitely something that has been on the rise, and you will most likely see it when you do clinicals in the hospital. It is contagious, and it can, lead to severe dehydration and even death in the patient. So we have to, have to definitely be watching out for it. And the C. diff, there's something, you need to know about that. There is, of course, odor of stool. All stool has a certain odor, right? But C. diff there's a distinct smell to it. Now, it's not all the time, but my experience, most of the time, there is a distinct odor to that. And when you smell it, you're like, okay, we need to get things rolling here for this patient. Um, so, anyway, that's going to be something you're going to get some experience with for sure. Okay, now causes and risk factors. Let's talk about those together here. So, anybody who takes a lot of laxatives, they are going to be at risk for diarrhea. Um, Drug therapy, certain drugs we know are going to cause diarrhea, such as some of these antibiotics we've been talking about. Um, any intestinal infection by virus or bacteria or protozoas, which is a type of organism, microorganism. So, again, if you travel to countries where they don't treat their water, don't drink the water. That's what we got to teach people about. But anyway, improperly prepared meat, poultry consumption can cause problems, and so we'll talk a little bit about that being part of your interventions to teach people proper ways. Undigested, of course, are highly spiced foods in the GI tract, a lack of those digestive enzymes, and of course the inflammatory bowel disorder. Okay, this is a picture of Crohn's disease, and this particular area of the bowel is the ileum, and you can see how inflamed the parts of the bowel are there. And, if you think about that, there's not going to be very much absorption of nutrients and electrolytes with that. This is a picture of ulcerative colitis, and you can see how damaged that inside of the bowel is. I mean, isn't that crazy looking? And it's amazing how you can think, goodness sakes, a person could make it with that. This is a picture of another condition that's really common that can cause diarrhea, and it's referred to as diverticulitis. And you can see where the little green picture there is what happens with diverticulitis is the bowel forms little pouches, and certain foods can get into those pouches and cause inflammation to occur, and they can, they can have diarrhea and serious problems. They can actually perforate, perforate meaning, a hole in that little pouch area there, depending on the severity of it. So diverticulitis can definitely cause issues for patients. So that's another one of those bowel disorders. Again, irritable bowel, any kind of neoplasm or cancer, the functional disorders that we talked about, hyperthyroidism. A person can have diarrhea for that if they have that. Surgical incisions of intestinal sections. So, if you take out a large part or a part of the bowel, that can cause a person to have diarrhea. HIV, and then, of course, again, specific drug therapy, chemotherapy, antibiotics. There's several out there, and as you read, you've read already some drugs that causes issues with the bowel. With infections, it's E. coli is very common, but Salmonella, uh, uh, Shigella, and C. diff, the Clostridium difficile, is C. diff. Virus, the rotavirus, is a common one we see with little kids. And then there's the protozoa, the type of microorganism as well that can occur. Now, I know this is a little bit blurry picture, but this is what a colonoscopy looks like, okay? When they go in the rectum with that scope, endoscopy, that has a camera at the end of it. I know I said microscope a minute ago, but it's not microscope, it's a camera, Lord have mercy. And, it's also able to, do biopsies, but you can see the visualization there is really, really, really good. And you see how inflamed and red that bowel is there. Okay, so question for you. Antibiotic-associated colitis is a mild condition caused by oral antibiotic therapy. True or false? Well, hopefully you said false because it's not a mild condition. It is a serious condition, and can be caused by antibiotic therapy, and it suppresses that normal flora, that normal bacteria in the colon, um, and the antibiotics allow proliferation of the pathogenic bacteria, especially C. diff. Okay, so characteristics of diarrhea, again, it can be acute or chronic, it can be mild or severe. And again, it's many times the body trying to rid itself of irritants, toxins, or infectious diseases. And most of the time it's self-limiting, anywhere from 24 to 48 hours. But severe and prolonged episodes definitely can cause us problems and, lead to the dehydration and electrolyte depletion. We got to watch about our children and our older adults because they are the most vulnerable with any sickness where they can, the complications can occur easier. Chronic diarrhea, folks can have remissions, with that. Like, what we mean by that, remission means, that it stopped for a little while. And then they can have exacerbations, which means those symptoms flare up. Uh, so, again, they can either have remissions or exacerbations. So let's talk about our medications used to treat. The first ones are the opioids related agents, and our diphenoxylate with atropine, and the trade name on that is Lamodal, is our prototype used to treat moderate to severe diarrhea, and it is a Scheduled 4 drug. Um, it is, notice it does have the atropine in there, and atropine, if you remember, the word anticholinergic. So remember the drill with that. Can't see, can't spit, can't pee, can't poo. Um, Remember about that. It's well absorbed. This medication is the diphenoxylate with atropine. The onset is 45 to 60 minutes. It's metabolized in the liver and excreted in the bile and feces, not in the urine. This one's in the bile and the feces. The action is to slow peristalsis. Peristalsis, we hadn't used that word, but that's your normal involuntary movement of your bowels. So it slows that by acting on the smooth muscles. Now, the max dose of this is 20 milligrams per day for adults. It is not used for children under age 2. Let's see. Extreme caution with liver impaired and renal. And in your book, it refers to that as hepatorenal disease. Okay, it puts those together. You don't see that too often, but anyway. Adverse effects of this going to be tachycardia, dizziness, headache, flushing, nausea, and vomiting, dry skin of the mucous membrane, and urinary retention. Hypotension and respiratory depression have occurred with people, especially if they use greater doses than what's ordered for them by their physician. So nursing implications is we got to look at those contraindications. So diarrhea caused by toxic material or microorganisms, we don't want to stop the diarrhea. We want to keep that, get that bad bacteria out of there with the diarrhea. We need to prevent those drug-drug interactions with this, and we got to assess for the therapeutic effects and adverse effects as well with these. And of course, to do the therapeutic effects, we got to talk to the patient about how's their bowel movements, what's the number, consistency, color, and then also look at our electrolytes as well to see if they're improved. And then, of course, we got to teach about, we're going to have some issues here with the, dry mouth, so we can talk to them about sucking on candy, keeping fluids going, for sure. And also, if they've got drowsiness and dizziness going on, they do not need to be operating heavy equipment. Okay, other meds here, paregoric and loperamide. The paregoric used to be a pretty common thing used, but you don't see it anymore. It is a Schedule 3 morphine type medicine, and it can be confused with opium tincture. The dose is much higher and can cause a major overdose here. Okay, so we've got to be careful with that, but you don't see this very much used much anymore. The loperamide is a synthetic derivative of meperidine, which is the trade name of that is Demerol, so that's a narcotic. It is unscheduled and OTC, doesn't penetrate the CNS like a narcotic Demerol. Note that the dosage on this don't exceed 8 milligrams per day on a non-prescription. if unsupervision of a healthcare provider, they should have 16 milligrams per day. Um, you may see an order for this type of thing in the hospital, like they'll say loperamide 4 milligram stat and then 2 milligram tablets after each loose stool, up to 16 milligrams. So you'd give a 4 milligram initially and then 2 milligrams up to 6 tablets if the patient has loose stools. So you may see an order like that. Adjuvant medications to manage diarrhea. Bismuth salts is one type that has antibacterial and antiviral activity. Now, bismuth subsalicylate. So when you see that salicylate, SALICYLAT, you gotta think aspirin, okay? Because that's what that is. So Pepto-Bismol is basically what we're talking about here. And it's over-the-counter, drug. Everybody knows about Pepto-Bismol. It has an anti-secretory and possible anti-inflammatory because of the salicylate component. So, aspirin is a common thing that folks are allergic to. So we got to ask them about allergies. And we also need to teach them that this will turn their stools dark. The bismuth part of the Pepto-Bismol will make it turn dark. So it's a harmless thing. We need to teach them to shake the bottle well and chew the tablets well as also. The octreotide acetate is a sandostatin, and this is a synthetic form of somatostatin, which is a hormone. And this can be used when diarrhea is associated with carcinoid syndrome, a cancer, or intestinal tumors, HIV, and diarrhea that's not responding to other anti-diarrheas. So, anytime, again, you wouldn't this would not be a drug of first choice, okay? Because there's definitely adverse effects. Anytime we give anybody hormones, there's going to be definite adverse effects there. Notice that on the adverse effects, one of them that's mentioned, this is used for diarrhea, and it can cause diarrhea. Isn't that crazy? It can also cause headache, cardiac dysrhythmias, and we have to give it subcutaneous so we can have pain at the site of injection there. So, again, that's some of your adverse effects for that. Now, continuing on with the medicines, the polycarbophyll or Fibercon and psyllium are most often used as bulk forming laxatives, but every now and again you'll see these ordered for diarrhea because they can help absorb toxins in water and decrease the fluidity of the stools. The pancrelipase is some medicines that used for people who have the deficiency in the enzymes of the pancreas, and folks who have malabsorption and steatorrhea. The cholestyramine and cholesterol are used in treating diarrhea for individuals who have bile salt accumulation, such as Crohn's disease or any surgical excision of the ileum. You'll also see this used sometimes for people who have got their gallbladder taken out. Antibacterial drugs will be used if there is a bacteria there and they having a fever or blood or pus that's present. Rifaximin is used for the traveler's diarrhea. Your nitazoxanide is used for the protozoa. One thing with that one, got to be careful about the drug-drug interactions because it does cause some issues with especially the blood thinner warfarin, because they're both competing for the protein for, they're highly bound to the protein, so they're competing for that. So the patient will have to be monitored if they're on that medicine really closely for their anticoagulation effects there. Um, the allosetron is a selective 5-HT3, which is having to do with our serotonin. So this is a drug that is an antagonist, and it's indicated for women with chronic severe diarrhea, predominant irritable bowel syndrome that's not responded to conventional therapy. And note that it does have a black box warning about the severe GI effects, constipation, possible obstruction, perforation, and hemorrhage. It's got to be under close supervision when patients take this, and they have to sign a consent form that they have been informed of the risk, and that they will discontinue the drug if constipation occurs, because it could lead to perforation. Okay, so our nursing process with patients with diarrhea. So we want to try to determine, how long this has been going on, what's the cause. Is it something they ate, where they ate it, traveling, what's stress. Stress definitely can cause diarrhea. And of course the duration. We want to look at the number of stools that they're having, what's the amount, what's the color, odor, consistency. Is there a change in pattern of and the description of the stool, such as, are they seeing pus or mucus or blood or fat? And definitely we'll try to get a stool specimen as well. And we got to be sure to look at our results on that stool culture, and sensitivity there. We want to look at the medical history and what medications they're on. We also don't want to forget about doing a perianal assessment of the rectal area to look for that skin breakdown. We got to do an abdominal assessment. Got to check about dehydration. So we're going to look in the mouth and the lips and the tongue and look at that oral mucosa. We're going to do that skin turgor test. We're going to check their intake, the amount of fluids and food that they're taking in, and what is their urinary output and stool output. Again, we're going to check that skin to see if it's dry. And we're also going to look at the lab work as far as electrolytes, especially potassium. We want to look at that because they can deplete their potassium and become hypokalemic. So it's a good thing for you to know that potassium level for sure. For interventions, we definitely want to provide instruction, teaching about how to prevent. And if you look on page 708 or to 709, it has your interventions there. We've got to teach about preparing and storing foods properly, and hand washing is going to be important. We're going to teach about monitoring their bowel movements, and to even make notes about it so they can bring that to their doctor. We want to teach them about the medications, how to administer those safely, and also about replacing fluid and electrolyte loss, such as, if they can drink any kind of tea, but it should be, decaffeinated, water, bouillon, clear soups, non-carbonated caffeine-free drinks, gelatin, that's also good. If it's severe, they're going to probably be in the hospital getting IV fluids such as dextrose and water, D5W, or normal saline, and they may have potassium added to that if they are depleted with that electrolyte. With that perianal assessment, if we see irritation there, we got to teach the patient, first off, the proper way to wipe. A lot of times, with severe diarrhea, especially for females, we've got our urinary system very close to our GI end of the GI system, and they can get a urinary tract infection. So we got to teach the proper way to wipe, and that being front to back, wiping their tail and keeping that clean, uh, and putting medication prescribed or not prescribed, petroleum jelly or something on that skin irritated area. And always talking about washing hands. We got to teach about that. And we're going to teach them about their adverse effects of their drugs to be watching for, and of course any kind of drug-drug interaction. Other things: chewing the food well, don't overuse the laxatives, and then provide supportive care. And that could be replacing the fluids. And that gives you an example there of the fluids that we already talked about as well. And of course, avoiding foods and fluids that may further irritate the GI tract, like spicy foods, that kind of thing. Also, raw fruits and vegetables, that can cause gastric motility, so we want to avoid that initially until the diarrhea subsides. The increasing frequency and length of rest periods and decreased activity. Exercise and activity stimulate peristalsis. So while that's going on, they're probably not going to feel like doing any kind of exercise, but we would want them to rest. And again, doing that perianal irritation care for the patient as well. And as always, we want to evaluate for therapeutic effects of the medication and of our teaching as well, and also adverse effects of the medications if they are indeed prescribed any for the diarrhea. Okay, that concludes your podcast.